Hi, this is Dr. Michael Lenz. I'm going to be doing a review on the recent documentary, What the Health. I have a background as a physician for 21 years. I'm board certified as a pediatrician and as well as an internist. I take care of adults. I'm also a diplomat of the Board of Clinical Lipidology and expert in kind of the management of cholesterol and related issues with overlap with diet, exercise, weight loss, and diabetes related issues. So I have a strong interest in this. I've been practicing a plant-based diet approximately the last 8 to 9 years. My wife is a dietitian, and I first heard about a plant-based diet when she was encouraged to read for her continuing education the China study. I read it and was very fascinated and read more and more. And the year the Forks Over Knives movie came out, the next year I completely went plant-based and really encourage my patients to do it. It has many benefits for their health. The recent movie, Whatthehealth, did an interesting job, kind of a lot of similarities with Forks Over Knives. There were some points that were brought up I just wanted to go over, and I'm sure with the documentary there is limited amount of time to fully discuss all of the nuances and details, and want to give a fair and balanced look at all of the data that was presented. Hope you enjoy, and please leave any comments.
350 million people with diabetes. There's no question that we're in the midst of a diabetes epidemic. Right now, 1 in 3 Medicare dollars is spent in the care of people with diabetes. 1 in 10 total healthcare dollars is spent on people with diabetes. There's no question that this is a major problem. What?
As a physician, I recognize and agree that diabetes is a huge problem and has so many factors. There's a lot of information of why diabetes is a problem. The number one killer related to diabetes is cardiovascular disease, which is heart attacks and strokes. There also can be complications known as microvascular complications, such as problems with nerve damage, blindness, problems with kidney failure.
In particular, the correlation with the diet and diabetes.
I'm not going to get into that.
Into diet?
No.
Found that very interesting that he didn't want to talk about the diet. We'll go over later and discuss some of the reasons behind that to probably give him a fair defense from his position and understanding of that, as I've talked to many people who have similar beliefs and backgrounds who aren't feeling that a plant-based diet necessarily is the only way you can control your diabetes.
Here in American medicine, we operate from the disease model. We are in the business of treating sick people. We are not in the business of trying to prevent people from becoming sick.
When you look,
I totally agree. The model historically is we treat a problem when it happens. One of the conversations I have with my patients is you can't feel plaque building up in your arteries. You can't feel until very late stages the effect of diabetes. So it's often a challenge to convince somebody that they actually have a ticking time bomb of plaque buildup in their arteries. Unfortunately, because heart disease is so common and because diabetes is so common, there is generally an awareness that the heart disease is a real issue, and they likely, as you likely know somebody who may have had a heart attack or died suddenly with no notice.
Diagnosed about 10 years ago with diabetes, and 8 years ago I had 2 stents put in. I don't know where to go, I don't know what to do. You're just like out of options, and you don't know what to do. You're taking medicine, you listen to this doctor, and the cardiologist says take this, and the endocrinologist says take that, and then your general practitioner doctor says you don't know what's going on here. And it's a real challenging thing, and it's something that you don't want to get.
Boy, feel your frustration, Michael, and unfortunately your story is awfully familiar. It's so common. You know, roughly half of people are genetically susceptible, eating a typical American diet, of developing diabetes. And going from the model of this managing his care, getting stents which help somebody get through the heart attack but don't prevent him from dying of a heart attack in the future. The diabetes medications that somebody has to manage, I'm sure what he's probably taking is likely expensive. There are medications that can help lower the blood sugar, but often some of them have many side effects. One of the questions that I often pose to my patients, if I paid you $300-400, which is the out-of-pocket cash cost that many of the better, if you want to call it, diabetes medicines called GLP-1 agonists cost, would you follow a plant-based diet if I paid you $300-400? Because that's the benefit, and you're going to get a greater benefit from eating a plant-based diet. And there's going to be some challenges in eating that, but it's definitely going to have a powerful effect. If I could put that in a pill, all of the powerful effects on his blood sugars, on blood pressure, on cholesterol. It's the only diet ever shown to reverse plaque in the earth.
Drive me crazy. Diabetes is not and never was caused by eating a high carbohydrate diet, and it's not caused by eating sugar. The cause of diabetes is a diet that builds up the amount of fat into the blood. I'm talking about a typical meat-based, animal-based diet. You can look.
Just wanted to elaborate on that. Our misunderstanding that I have from many of my patients is that eating sugar directly is what's causing my blood sugar to go up. Eating carbohydrates is what's causing me to have diabetes. Now, part of this understanding is the traditional diet education in the American Diabetic Association diet, which is carb counting. The carbs are considered the bad person. What we understand in research is that fat is what gets into the main cells that process insulin, which is the liver and the muscle cells, which cause problems. Now, that said, eating just sugar, eating things that turn to sugar quickly, is not good. Carbohydrates that do not have fiber will not fill you up. They will be stored eventually as fat if you don't burn them up. So this isn't a carte blanche to just go eat refined carbohydrates. What a low-fat, whole foods, plant-based does is you want to eat carbohydrates that come with fiber, with whole grains, fruits, vegetables, and legumes.
My name's Amy Resnick, and I'm from Swampscott, Massachusetts, a little bit north of Boston. And I recently went to my doctor for asthma because I have a very hard time breathing. And while there, she did some blood work, and one of the tests was C-reactive protein, and on a scale there was a scale of 1 to 3, 1 being low for cardiac event, 3 being high for cardiac event, and my number was 10.82.
What does that mean?
That means I am on the road for a heart attack, and she said probably within the next 30 days.
30 days?
30 days.
So just wanted to clarify that, give you a little background. C-reactive protein is a protein that is elevated when there's inflammation in the body. This can be for many different reasons, from infection, but we do know that as part of the problem with atherosclerosis and the precursor to actually having the heart attack, where there's plaque rupture in the lining of the arteries, inflammation. You can the test called the high sensitivity C-reactive protein is measuring low grade levels of inflammation that are a marker for increased risk. Now, the doctor, or at least the patient here, reports that her doctor said you're going to likely have a heart attack in 30 days is a bit of a hyperbole. The chance with that C-reactive protein alone that she's likely going to have a heart attack in the next 30 days is not likely, but her lifetime risk of having a heart attack with a C-reactive protein of 10 is in about roughly 2.5 to 3 times greater than somebody who has a C-reactive protein of less than 1.
Going the way I was going. I take this for my heart arrhythmia, take this for pain, oxycodone for pain, and lorazepam for stress. cyclobenzaprine for a muscle relaxer, also take Topamax and Prozac, and I also use a CPAP machine to help me breathe. And my asthma has been so bad this past year, I use it during the day as well to get some air. I am tired when I wake up. I'm tired during the day. I take a nap. I'm still tired. I can't breathe. And I know I need to make a change for my health, or else I'm not going to be here for my family.
When we speak of heart disease,
A lot of things that she mentioned that are going on. She has what sounds like a history of multiple medical problems. Sleep apnea, there's a strong connection between obesity and sleep apnea. One of the things, her being a woman, women often after menopause are missed. The good news is actually people can reverse their sleep apnea through weight loss with as little as 20 pounds. She also has a history of chronic pain with likely, assuming probably migraines, as she's on a medicine called Topamax, which is a medicine that helps decrease the frequency of having migraines. She also is on cyclobenzaprine to treat chronic pain syndromes. There is a connection between eating healthy and pain. There's a connection between eating whole foods, plant-based diet that helps. I have many patients who have history of irritable bowel syndrome who have an excellent response to eating a low-fat, whole foods, plant-based diet. It's really encouraging. But hopefully, as the movie portrays later, she does go on a plant-based diet and does have improvement in the multiple health problems she's had. Unfortunately, her history is all too common and something I see weekly, if not daily, in my clinic.